Let's talk about some relevant terms. The language of anatomy. The anatomical position is the position we use as a reference point in order to accurately describe body parts and location. This is the standard position used when we reference body parts, regardless of the actual body position. For example, even when a patient lays face down, we describe the body positions as if he or she were standing up straight and the palms forward, which is our anatomical position. Regional terms. There are many of them, and you best make sense of them by first figuring out which ones you know, and then with the other ones you try to figure out how to visualize what it could mean and make a mnemonic out of that. I learn best by labeling those terms over and over again. All right, let's start in the front. We'll go down on the left side. Cephalic refers to the head. Frontal is the front of the head. Orbital is the eye socket. Nasal refers to the nose. Buccal, the cheeks. Oral, the mouth. Mental, the chin. Cervical is the neck. Thoracic means chest. Sternal is the breastbone area, and axillary refers to the armpit. Abdominal refers to the stomach area, and umbilical is the place where the belly button is. Pelvic is the area of the pelvic bones, and inguinal refers to the groin. The pubic area is where the genitals are, but actually it's the lowest portion of the pelvic bone, and that is basically where the genitals are. When we go to the right side, we're looking at the upper limb there. The acromial is the tip of the shoulder. The deltoid is the highest part of the upper arm. And as we move a little bit towards the elbow, we then call it brachial. Antecubital refers to the front of the elbow. And antebrachial refers to the forearm. Carpal means wrist. Manus, hand. And digital or digit means finger. To the lower limbs, coxal means hip, femoral thigh, patellar kneecap, crural leg, or basically means below the knee. Fibular is referring to the outside part of the leg. Tarsal is the ankle, and pedal refers to foot, and digital again are, well, here they're toes, not fingers. Going to the next one again on the left side from the back. We only gonna do the non-repeated terms. The other ones we already went through. So in the upper limb we have olecranon, and that's the tip of the elbow. And then in the lower limb we have the popliteal, and that's the back of the knee. Sural refers to calf. Pedal to the foot. Calcaneal refers to heel, and plantar refers to the bottom of the feet. On the right side, we have a few more terms. Occipital refers to the back of the head. In the back, we have scapular, which is where the shoulder blade lies. Vertebral, which is overlaying the vertebral column, so it goes all the way from the neck down to the butt. And gluteal refers to the butt. Then we're going to make our way through directional terms. They allow us to explain where one body structure is in relation to another. Superior is the most commonly used term here, and it means above. The nose, for example, is above the mouth. I hope so. And that means the nose is therefore superior to the mouth. Inferior means below. Anterior refers to in front, posterior to the back, medial is towards the midline, and lateral is towards the outside. These next terms are used for the upper limbs mainly. Proximal means closer to the attachment, and distal means further away from the attachment. For example, the shoulder is proximal to the elbow. The fingers are distal to the elbow. Superficial means on the surface, and deep, well, that means deep inside the body. That brings us to body planes and sections. Many number of axes and planes may be drawn through the body, but it is customary to describe 3 planes. We use this stuff for orientation of images. For example, MRIs are taken to visualize internal body structures, and they come in these different planes. The 3 main planes described run perpendicular to one another. That means perpendicular means they run in right angles to one another. So we have the first one is the sagittal plane, and that separates the body into right and left. Then we have the frontal, and sometimes they call that the coronal plane, and that refers to the body front to back. The transverse plane separates the body into top and bottom. Body cavities is the last topic of today's lecture. Maintaining boundaries is very important and necessary to sustain life, as we've learned. The skin protects us from the outside world, but internally we have many different organs, and they need to be in different environments, and we need different levels of protection for them. So the body has a posterior or a dorsal, as well as an anterior or a ventral cavity. The dorsal one is further divided into a cranial and a spinal cavity. The anterior, which is separated by the diaphragm, which is right below the rib cage, or inferior to the rib cage, that one is separated into a thoracic and abdominal pelvic cavity, and then the latter can be further subdivided into a abdominal as well as a pelvic cavity. All right, well, I think we did some good work. I hope you got most of these concepts, and we'll be discussing them in class.